Bismillahirrahmanirrahim. Assalamu alaikum, dear students. In this lecture, we will discuss about the most important MCQs on measles, mumps, chain of infection, and normal flora, and the isolation of the pathogen in the hospitals. A compound synthesized by bacteria or fungi that destroys or inhibits the growth of other microbes is called antibiotic. Which statement is not an aim or in the case of drugs? In antimicrobial chemotherapy, the drug should be broken down and excreted rapidly. This is not the characteristics when we use the chemotherapy. Paramyxoviruses have all of the following properties except paramyxovirus consists of segmented genome. The paramyxoviruses have no segmented genomes. Each of the following pathogen can cause respiratory infections in human except to amongst these rabies is not the respiratory infection, it is the nervous infection. It mainly infects the CNS and found in the nerves. R factor are the dash that contain a code for which the R factors are the plasmids actually that code for the drug resistance. When a patient immune system becomes reactive to a drug, that is an example of allergy. It is called the allergy or hypersensitivity. Respiratory syncytial virus primarily infects the lower respiratory tract of lungs. It can cause bronchiolitis and pneumonia in children and elderly people. Which of the following virus is not common pathogen found in lower respiratory tract infection? The lower respiratory tract infection rhinovirus is not the lower respiratory, it is the infection of the upper respiratory tract. Which of the following is an example of this natural host of the mumps virus? So mumps virus has natural host human. An antibiotic that disrupts the normal flora can cause superinfection. Most antihelminthic drugs function by inhibiting worm metabolism. Select a drug or damage a drug that can prevent a viral nucleic acid from being replicated. Both A and B are the antiviral drugs that are used to inhibit the viral nucleic acid, the azithromycin and the amantadine. Both A and B are the correct. Which of the following effects do antiviral drugs not have? So, killing extracellular viruses. Extracellular viruses cannot be killed by the antiviral drugs. Which of the following modes of action would be most selectively toxic? Preventing cell wall senses. Cell wall senses prevention is the selective toxic action because cell wall is absent in the eukaryotic cell. Cell wall is absent in the humans. Measles virus is transmitted through airborne droplets and in one of the leading cause of respiratory infection, mostly seen in the children and developing countries. Which of the following statement is not correct about the epidemiological features of measles? So more than one serotype of the virus has been identified. It is not the correct. Mumps is highly contagious virus infection transmitted from person to person. Which of the following is not the common symptom of the mumps virus? So it was the question in Cambridge 22. So skin rashes is not the symptom of the mumps virus. Which of the following are the pyogenic coccus? So all of these are pyogenic coccus. Pyogenic coccus are the bacteria that are the pus forming bacteria. So Streptococcus, Neisseria and the Staphylococcus all are the pyogenic coccus. The coagulase test is used to differentiate Staphylococcus aureus from the other staphylococci. The symptoms in scarlet fever are due to the erythrogenic toxin. All of the following statements about measles, rubella, and German measles are true except rubella virus causes swelling of the salivary glands. So, rubella virus cannot cause the swelling of the salivary glands. Which of the following age group have been found to be most affected by the para-influenza virus? So, babies are mostly affected by Parainfluenza virus. The most severe streptococcal disease are caused by Group A streptococci. Rheumatic fever damages the which part and glomerulitis damage the dash. Rheumatic fever damage the heart valves and glomerulitis damage the kidneys. Which of the following statement is correct about congenital rubella syndrome? Children born to unvaccinated mothers are at higher risk. The symptoms of the measles virus infection develop within 2 to 5 days. The most common is skin rashes. Which of the following are not other symptoms related to the measles? To enlarged salivary glands is not the symptom of the measles. To enlarged salivary glands are the mainly symptom of the mumps, and the skin rashes is not the symptom of the मम्स। ठीक है, तो ये दो आपस में डिफ्रेंशिएट करने हैं। तो स्किन रैशेज आर द कॉमन सिम्टम ऑफ द मीजल्स एंड द enlarged salivary glands are the common symptom of the mumps. Patient infected with the pathogen transmitted by the small particles droplet would be placed on which isolation? So it is airborne isolation. Choosing PPE, personal protective equipment, based on the procedure would be which type of precautions? It is standard or universal precaution. Uh, the in, the incubation period of viral hepatitis A is, so it is 10 to 15 days. Hemolysis is the partial lysis of red blood cells due to bacterial hemolysin alpha. Which isolation does the rule you can maintain a distance of 3 feet without a mask applied to? So it is the droplet isolation. Patient infected with pathogen transmitted by large particle droplets would be placed on which isolation? So it is droplet isolation. Which one of the following viruses is the cause of congenital malformation? So rubella is the congenital malformation cause. Orchitis, which may cause sterility, is possibly possible manifestation of which of the following? Orchitis is the mumps. A structural component that is found in all viruses is the capsid. Each of the following statements about the measles vaccine is correct except it is available only in monovalent form. No, it is available in the trivalent form. Measles, mumps, rubella. Mumps virus can primarily infect which of the following organ? So mumps mainly infect the salivary glands. This type of isolation requires sterile PPE to enter the room. To protective isolation. This type of isolation precaution requires the HEPA N95 mask to be worn before entering the room. So airborne isolation. Which type of isolation precaution is used strictly for protecting the patient? So it is protective. The outside of any PPE is considered contaminated. A culture of the targeting zero healthcare associated uh, infection and zero tolerance for unsuspected disease is characterized by each of the following except. So performing annual review of the site infections to determine the post common type of the pathogen accountable for infection prevention. So it is not the correct. इसके अलावा बाकी जितने भी हैं वो करेक्ट ऑप्शंस हैं देखें an expectation that infection prevention and control measures will be applied consistently by all healthcare workers 100% of the time. A safe environment for healthcare workers to pursue 100% adherence where they are empowered to hold each other to. So all are the correct, but this is not the correct. Area where the causative agent can live is called reservoir. The chain of infection में से उठाया है. Area where the causative agent live is called the reservoir. The inside gown of gown and the gloves and ties on mask are considered to be clean. If you acquire an infection while it is at the hospital is called the nosocomial infection. Hospital acquired infection are called the nosocomial infection. The chain of infection is a model of how pathogenic microorganisms are transmitted from one person to another. So it was a question in 2022. There are 6 links in the chain of infection. These include each of the following except So personal protective device is not the part of the chain of infection. Any healthcare settings, the chain of infection can be interrupted most rarely at the site of mode of transmission. तो मोड ऑफ ट्रांसमिशन हम चैन ऑफ इन्फेक्शन को ब्रेक कर सकते हैं. यूनिवर्सल प्रिकॉशंस में मैंडेटरी रेगुलेशन enforced by the OSHA in all healthcare setting is part of its blood-borne pathogen standard. Patients with the staphylococcus or E. coli are placed on which type of isolation? So it is a contact type of isolation. Tuberculosis patients are placed on which type of isolation? Airborne isolation. Each of the following is true about the standard precaution except. So a healthcare personnel caring for patient wear a gown and gloves for all interactions that may involve interact with the patient or potentially in contaminated areas in the patient's environment. This is not the standard precaution. तो बाकी जितने भी ऑप्शंस हैं वो स्टैंडर्ड प्रिकॉशंस के पार्ट हैं. Immunocompromised patients are placed on which type of isolation? So it is the protective type of isolation. Pneumonia and influenza patients are placed on which type of isolation? So it is the airborne isolation. It infects the respiratory tract. और ड्रॉपलेट टाइप ऑफ आइसोलेशन भी इसमें से इसमें आंसर होगा. तो इसमें बोथ ऑफ दीज आर द बेस्ट आंसर. ठीक है. There are three recently added elements to standard precautions that focus on protection of patient. These are respiratory hygiene, जिसको कफ एटिकेट्स भी कहते हैं, सेफ इंजेक्शन प्रैक्टिसेस और यूज ऑफ मास्क फॉर इंसर्शन ऑफ कैथेटर. तो रेस्पिरेटरी हाइजीन जिसको कफ एटिकेट्स कहते हैं इंक्लूड्स ऑल ऑफ द फॉलोइंग एक्सेप्ट. तो रेस्पिरेटरी हाइजीन या कफ एटिकेट्स में ये सारे ऑप्शन होंगे, एक नहीं होगा तो कौन सा नहीं है? तो हेल्थ ऑप्शन नंबर E is correct. Healthcare workers wear a gown and gloves for all the interactions that may involve the contact with the patient. So it is not correct regarding the respiratory hygiene. Safe injection practices require adherence to basic principle of aseptic technique for the preparation and the administration of parenteral medications. Each of the following statement is true except for reinsertion of used needles into multiple dose vial or solution container is acceptable as long as needle is disinfected after each insertion. It is not correct. For your protection, which type of isolation require gloves to be worn when coming into contact with the patient or contaminated surface? To contact. This type of isolation allows for patient to have different diagnoses in the same room if 3 feet are maintained between them. Droplet. Transmission-based precautions are second-level precautions used when the routes of transmission not completely interrupted using standard precautions alone. Each of the elements below is true except. So in settings where airborne precautions cannot be implemented due to limited engineering resources, so this is not the precautions of the second level. Vaccines are available for prevention of infection caused by all of the following viruses except human parainfluenza virus has no vaccine. When was the first dose of MMR vaccine approved and distributed to the public? So it was 1971. MCQ number 61 is the first dose of MMR. MMR stands for measles, mumps, rubella vaccine and varicella vaccine. VAR is most effective for which of the following age group of people? So it is 12 months to 10-year-old. Which of the following viral infection is most commonly associated with the varicella virus? So it is the chickenpox virus. Children infected with the measles virus may die when symptoms worsen and become chronic. Name the common complications that occur if the chronic infection develop in infants and children. So it is encephalitis, that is the inflammation of the brain. Vaccine is only an important effective preventive method for mumps. Symptoms of the mumps usually disappear. Uh, Symptoms of the mumps usually disappear within how many days after the initial infection? So it is 1 to 2 weeks. The best descriptive term for the resident microbe is commensals. Which of the following microorganisms are the most commonly found normal flora in the healthy human body? So mainly bacteria are found in the healthy human body. Which of the following microorganism is a part of the normal flora of the skin and is also common pathogen started from the skin infection? So it is the Staphylococcus aureus. Name the fungus that is a part of the normal flora present in the female genital tract and is also common cause of the vaginitis. So it is the Candida albicans. Which of the following microorganism is the predominant flora of the skin? So it is Staphylococcus epidermidis. It was a question in 2022 microbiology. Name the fungus commonly found as a part of the normal flora in the nails. It is Aspergillus species. Which of the following microorganism can be found as a normal flora as a, in the narrow nasopharynx of healthy individuals? So Streptococcus pneumonia. Which of the following bacteria is present as a normal flora in the acidic pH of the female genital tract? So Lactobacillus acidophilus. It was also the question in the 2022 paper. Which of the following coliform bacteria is predominant in the human gastrointestinal tract? So Escherichia coli. Select all the beneficial roles of normal flora present in the human body. तो इसमें ये तीनों ऑप्शन ठीक हैं. Provide defense against the microbial pathogen, help in the digestion of food, contribute to the development of the immune system. तो तीनों जो ऑप्शन है ये ठीक हैं. तो इसमें अगर आएगा all of these तो sorry all of the above तो all of the above best option है. Which of the following bacteria is a part of the normal flora present inside the mouth and also a frequent cause of bacterial dental caries? तो इसका जवाब है Streptococcus mutans. Which of the following stepworm parasite is usually found in raw pork? तो raw pork में होता है टेनिया सोलियम. तो रा जो केटल होगा उसमें टेनिया सजिनेटा होगा. तो पोर्क में टेनिया सोलियम, इसको पोर्क वर्म भी कहते हैं. नेम द कॉमन waterborne illness that is most prevalent in the nations like the Haiti, India, Nepal and other poor regions with lack of the clean drinking water and the good sanitation practices. So it is cholera. Which of the following gram-positive bacteria is common pathogen that can adulterate dairy and the frozen products? So Listeria monocytogenes. Canned food poisoning is commonly linked to which of the following microorganism? Clostridium botulinum. Select all the pathogens that can be transmitted to humans through the consumption of poultry and the poultry products. तो H5N1, Salmonella typhi, Campylobacter jejuni, ये तीनों ऑप्शन इसमें आते हैं जो पोल्ट्री रिलेटेड इन्फेक्शन काज करते हैं. Mebiasis is a common human intestinal infection transmitted through ingestion of contaminated water and food. Name the pathogen associated with the disease. तो इसका ऑप्शन होगा Entamoeba histolytica is the causative agent of the amoebiasis. MCQs number 82 is what is the name of the parasitic illness that is primarily associated with fecal contaminated swimming pools and can cause diarrhea in humans? So it is the cryptosporidosis. Which of the following foodborne bacterial infection is a common cause of bloody diarrhea? So shigellosis is mainly responsible for the bloody diarrhea. Name the intestinal parasitic infection in humans spread by the consumption of contaminated water and food. It is cyclosporiosis. Which of the following foodborne virus can cause stomach flu that is commonly found in raw or uncooked seafood such as the shellfish and the oysters? So it is the norovirus. Name the microbes spread through the fecal-oral route and is mostly associated with the infection jaundice, hepatitis A virus. Shigellosis is also known as bacillary dysentery. Which of the following enteric parasitic is one of the common causative pathogen of helminthic infection that is prevalent in subtropical region of the world? It is Ascaris lumbricoides. All of the following major foodborne pathogens produce microbial toxins except Pseudomonas aeruginosa. Which of the following foodborne bacteria can grow well in low temperatures and is commonly found in contaminated unpasteurized refrigerated foods such as the milk and the meats? So Listeria monocytogenes. The hepatitis infection that is most commonly transmitted through the fecal oral route is caused by which of the following types of hepatitis virus? Select the correct answers. तो इसमें hepatitis E और A दोनों options ठीक हैं. Which of the following enterohemorrhagic gram-negative bacterial strains is the common cause of intestinal infection in humans? So it is E. coli 0157H7. Which of the following foodborne parasite is transmitted to humans through the ingestion of undercooked or raw pork? So it is Trichinella spiralis. Thank you so much. These are the questions collected from the different sources as we have when we check the paper. So these questions will be very helpful in the exam. Thank you so much.